The rate of COVID-19 infections in parts of the country is raising the alarm, and provinces are reacting differently. Just this week, Ontario tightened rules for restaurants and bars and shut down strip clubs. Meanwhile, Quebec is urging the public to avoid all social gatherings for the next 28 days. And starting tomorrow, in and around Winnipeg, masks will be required in all indoor public settings, and gatherings will be limited to 10 people. Are these measures enough? What should people be doing to keep themselves and others safe? Let's bring back infectious disease specialist Dr. Isaac Bogosh. And Dr. Bogosh, the situation varies from province to province. How effective are the kinds of targeted restrictions I just mentioned?
I think they'll have some effect. Really what we're looking here is some incremental additional safety and some incremental benefit. I don't think any one of these policies is going to be a silver bullet that's going to get it under control. We really have to look at the cumulative policy that keeps these provinces safe and our federal guidance as well. Certainly there's going to be some differences between the provinces, and that's why they might be taking slightly different approaches. But when we sort of take a step back and look at the big picture, we know that the drivers of infection are probably pretty similar in most of those provinces, largely driven by indoor gatherings, either at work or at restaurants or bars or at private gatherings, and really focusing our attention on those to keep numbers as low as possible is really the right way forward.
Now, in some provinces, notably Atlantic Canada, case counts are very low. And in other provinces, there are health authorities who feel the numbers are under control. But what sort of advice would you have for people in those parts of Canada?
I think continued vigilance is extremely important. We know this is a very contagious infection. It doesn't stay restricted to one age group for long. It doesn't stay restricted to one geographic location for long, and you really need continued vigilance. The other thing, too, is to really learn from our prior Canadian experience and from the global experience. We don't need to make the same mistakes twice or three times over. We already know how this is transmitted and where it's transmitted, and we can be proactive in really making policies to prevent transmission or even the introduction and transmission of this virus in many settings.
I know there are a lot of people who yearn for simple rules, kind of binary, mask on, mask off kinds of rules. But when I hear, for example, Dr. Bonnie Henry talk about our social bubbles, you know, it takes a while to explain to people what that means and how to assess them and how to figure out. One example she gave is if your son, teenage son has a girlfriend, you have to talk to their family to kind of figure out how much contact they have with the outside world. What advice do you have for people who are kind of rethinking their social bubbles or circles?
I think at this point in Canada's epidemic, the best thing to do is just to keep it as small as possible and really restrict our social gatherings to as few people as possible. I appreciate that the senior political leadership and senior public health leadership is trying to set some concrete guidelines and say, X number of people here or Y number of people in those settings. But in general, we should really not be socializing, and we should really be restricting all of our interactions and really keeping it to as few people as possible. We've got a big outbreak going on in Ontario, Quebec, British Columbia, and Alberta. The rest of the country is certainly prone to this. This is the time to keep it tight and within the family rather than opening things up.
So that answer kind of anticipates my last question, but I will still ask it because it's timely. Thanksgiving is coming up, a really important time for a lot of families in this country. What should people be keeping in mind?
In all fairness, I think that if you don't live under that roof, you shouldn't go into that house. And we should really keep this as small as possible. And it's a simple rule, and it's easy to understand, and it's pretty effective. And there's going to be a lot of virtual Thanksgiving dinners, and that's okay. And if we all do our part, we'll get through this faster. So I think that's the key message. If you don't live under the roof, don't go in the house.
Well, as you said, nice, clear advice, and we really appreciate it. Thank you very much.
My pleasure.